In this video, we will be assessing risk of bias across study designs. We will be analyzing a randomized controlled trial, cross-sectional designs, cohort studies, case control designs, and a systematic review. You can access the chart below this video that we will be referring to throughout the video.
To start, randomized controlled trials most often use two groups to assess a particular therapeutic intervention to demonstrate causation of an event. One group is called the experimental group, who receives the treatment, and the other group is called the control group, receiving an alternative treatment, or no treatment at all. In the beginning of these types of studies, participants that meet the inclusion criteria should be allocated to the experimental and control groups in a concealed and randomized manner. The second aspect that should be met is prognostic balance. This consists of control and experimental group that is relatively similar as measured by demographic factors, such as age, sex, and occupation, disease-specific factors, stage or severity, medical comorbidities, such as cardiovascular disease, arthritis, diabetes, and obesity, and biobehavioral comorbidities, depression or incentive for recovery, among others. In the middle, during the study, risk of bias is assessed through blinding and the adequacy of assessments used. The first question to ask is, are the evaluators blinded to the status of individuals in the intervention and control groups? If not, it is possible that evaluators could influence the results by giving a group more or less favorable evaluations or treatment based on their perceptions of the study. Do the assessment tools adequately assess patient conditions? For example, if edema is the condition being treated within the study, do the evaluators choose correct tools to measure such conditions of the selected patients? At the end of the study, risk of bias can be due to dropouts within the study. That is, subjects who did not follow through or were non-compliant with study protocols. Such reasons can include illness or purposeful decisions to leave the study. For participants who drop from the study, the evaluator should have run an intention to treat analysis, which gives a statistical comparison between the intervention and control groups, as if every subject at the beginning of the study complied with the study protocols. For the end analysis of a study, the reader should also ask themselves if follow-up was mentioned by the authors in the study. That is, did the evaluators follow up with patients after the conclusion of the study, for example, at 3, 6, or 9 months post-treatment? Now we will move on to the observational studies, with the first being a cohort study. Cohort studies follow subjects over a set period of time, and they often share common characteristics such as age, gender, and occupation. More than one group is often followed. An example of a cohort study would be an examination of babies born at a certain time that were exposed to cigarette smoke, and if they were more likely to develop a certain disease than babies born at the same time not exposed to cigarette smoke. At the beginning of the study, prognostic balance should be met, which again should consist of two groups that are relatively similar as measured by demographic factors, disease-specific factors, medical comorbidities, and biobehavioral comorbidities. At the middle of the study, the question that should be asked is, are the assessment tools able to adequately assess patient conditions? You can refer back to the edema example given during the explanation of randomized controlled trials. At the end of the study, statistical adjustment for prognostic imbalance should be assessed, and the reader should also ask themselves if follow-up was mentioned in the study. Again, that is, did the evaluators follow up with patients after the conclusion of the study, for example, at 3, 6, or 9 months post-treatment?
In our next section, we will be analyzing case control designs, which are a retrospective approach where subjects who are known to have an outcome of interest, for example cancer, are compared to similar subjects who are free of that outcome. In the beginning, matching subjects are analyzed to see if they have similar prognostic factors. In the middle, exposure is analyzed, and you should ask if the individuals were exposed to a factor in question and were all the patients screened for, say, cancer in the same way. The end analysis should question if the authors adjusted for prognostic factors. The next section we will be moving on to are cross-sectional designs, which are studies that collect data about a phenomenon during a single point in time. In the beginning, were individuals appropriately selected? That is, were individuals correctly chosen based on specific inclusion criteria? The next question is spectrum bias, which determines whether the researchers try to incorporate a variety of individuals in the study and not just focus on a sick or very healthy population. In the middle, independent criterion standards are assessed, which compare the test in question to the gold standard. The second question is, do the assessment tools chosen for the study adequately assess patient conditions? For example, if edema is the condition being treated within the study, did the evaluators choose correct tools to measure such conditions of the selected patients? At the end of the study, was there appropriate blinding of evaluators? That is, were the evaluators blinded to the status of individuals in the intervention and control groups? If not, it is possible that evaluators could influence the results by giving a group more or less favorable evaluations or treatment based on their perceptions of the study. The last section that we will be addressing are systematic reviews. In the beginning, the reader should examine the PICO question, which includes 4 parts: patient problem or population, intervention, comparison, and outcomes. An example of such a question is as follows. In patients who have suffered a stroke, does constraint-induced movement therapy compared to exercise increase functional independence? In the middle, critical appraisals should have been conducted, meaning a standard form was used, such as a Pedro form, used to systematically analyze studies. Next, studies that were chosen should have clear inclusion criteria. Such components would include patient population, interventions, study endpoints. Lastly, reproducible results and comprehensive search strategies should be addressed. Here you should question if the authors reviewed multiple databases for articles to include in their systematic review, with an exhaustive list of search terms. A multifaceted search consisting of electronic databases, manual searches or retrieved references, English versus non-English, funding agencies, trial registers, and meeting abstracts. Reproducible results indicates if anyone wanted to do a systematic review, there was explicit criteria mentioned on how the study was conducted. At the end, the reader should question if homogeneity was achieved, which refers to the degree to which the results of studies included in a review are similar.